We just have had approval from Baycrest Hospital to start on the project. And one of the studies that was key on this last August was done in Sweden that showed that one of the more effective therapeutics against the COVID virus was nitric oxide, but nitric oxide is not very easily applied to people as medicine. But we know that when we vibrate the body, and this can be at a pretty slow rate, as in if you go running, your feet hitting the ground shakes up your body. That would be at about 3, 4, 5 times a second. We know in the area of 30 to 100 hertz has this effect, stimulates the lining of blood vessels, the endothelial lining, and releases nitric oxide. And so potentially there's a strong effect. What we're looking at is the effect of the cognitive decline that follows having COVID, and we will try to use vibratory sound along with the endothelial nitric oxide release and other brain factors to see whether there may be a rehabilitative effect on this cognitive decline. So that's starting now. If you know people who have had COVID, who are been hospitalized, or who had COVID tested positive, were not hospitalized, we'd be happy to have them volunteer for the study if they have experienced some cognitive effect, brain fog, memory problems, etc. We know it can be applied very directly to blood pressure, so that within 15 minutes of sitting on this vibroacoustic device and listening to low frequency sound stimulation within that 30 to 60 hertz